Hi, everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at PetAbility Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links. Proceeds from purchases help to support our show. Thanks for listening.
We hope you enjoy the show. Welcome to PetAbility. I'm your host, Kathy Simon, certified veterinary technician and certified canine rehabilitation practitioner.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Hey, Kathy, how's it going today?
Hey, Chris, I am doing pretty good. What's going on over there?
I wanted to let our listeners know that you were recently interviewed by Erin, the dog mom, on her podcast, Believe in Dog.
I was. You know what? Erin is so nice. If listeners enjoy our show, I think they would also enjoy listening to Erin, the dog mom at Believe in Dog podcast. We talked at great lengths about living with blind dogs, which you know is my jam. And she probably had to cut me off because there was so much I had to say about the joys of living with a blind dog, or the joys of, training your blind dog, and the joys of seeing your blind dog be confident and have successes. So it was a great topic to talk about.
Yeah, and we had interviewed Erin regarding her dog health journal in April of this year and connected that way. And then she learned that you're a blind dog aficionado and asked you to be on her show.
I think it's going to air in November, but we'll keep everybody posted on when that's going to come out, and my message is always the same whenever I talk to anybody about blind dogs, that blind dogs can live happy, joyful, interesting lives without vision. So
absolutely. Well, I'm glad it went well.
Thank you.
You know what else? I know I texted you about this because I was so excited. This weekend, I saw a commercial that Subaru is declaring October 22nd as National Make a Dog's Day. This is really special because Subaru is promoting the adoption of senior, geriatric, older pets and differently abled pets. So on the commercial, you see one-eyed dogs, dogs with missing limbs, a dog in a wheelchair. And of course, we're all about that, right, Kathy?
Oh, yeah, no, I sobbed when I saw that commercial.
I know.
And you know what? Kudos to Subaru. I'm a Subaru owner. I love my Impreza. I love that they're highlighting senior dogs, differently abled dogs. Yeah, I think these dogs are often overlooked when it comes to people going to the whatever shelters and stuff and looking to adopt a dog. And maybe that's not the dog. Maybe the three-legged dog isn't for you, but I think it's worth meeting that dog and seeing. You don't know, you might connect. So kudos to Subaru.
Absolutely. And just like you were saying, living with blind dogs, you've had a few in your life, and, they did bring you great joy, even they're living joyful lives. But these dogs have so much love and life left in them. Just because they're different doesn't mean that they're lesser than. So I really love the fact that Subaru is putting this on a national stage and for everybody to see. And
just FYI, Chris and I text each other immediately as soon as we see a differently abled animal on television. We are immediately texting each other.
Oh, yeah.
Yeah. So thank you, Subaru. Thank you.
So, Kathy, let's get to today's topic. It's one that we've discussed for a little bit. We've wanted to consult with some experts. And today we are thrilled to have Courant-Morgan and Stephanie Keasey-Phelan of the Dog Behavior Institute. So they are two board-certified behavior analysts dedicated to one mission, making life better for dogs and their people. So they teach individuals, families, and dog professionals how to better live and work with dogs. Now, the reason that we brought them onto the show today is we are specifically interested in the topic of pain and how that might lead to a change in behavior for a dog. Can that be a trigger and make them act out differently, change their behavior? So that's what we're going to be exploring today.
specifically, I think we talked about, is there a correlation or relationship to pain and aggression? It's a complicated topic because aggression itself is a complex and multifaceted issue, and there's so many things that can affect a dog's behavior, environmental and social factors and genetics, and the possibility of pain changing that as well. So I'm really interested to hear what they have to say about that.
And what's really cool about the Dog Behavior Institute, Kathy, is that they use evidence-based, data-oriented practices versus what may be popular, at this point in time in terms of training, the flavor of the day. Gosh knows that how we train our pets has certainly evolved over the years in a very positive way, pun intended. And so they definitely follow the science. They use an individualized, customized approach, again, positive, force-free methods. And the emphasis is on why a dog engages in a particular behavior or behaves a certain way. And I remember Rand reached out to me over the years a few times to show me videotapes online of dogs that they're working with, asking specifically, do I see anything off, anything that could be pain related, any biomechanical issue? And so I know that this certainly is top of mind for the Dog Behavior Institute in terms of, a possible factor or trigger. So we thought this would be a perfect fit because Kathy and I, again, have been interested in how pain might lead to change in behavior for a long time. And for those of you that are avid listeners, we had Rand on the show back in September of 2021, talking about punishment and its fallout. And Rand, you may be delighted to learn that it is the number 4 most downloaded episode since we started in March of 2020. And we have 96 shows out at this point.
Yay.
I know, it's so crazy, but I love it. So hopefully this will get even more downloads. And this is going to be even bigger and better because we're able to glean more information as Rand's business partner, Stephanie, is able to join us for this discussion about pain and aggression. So welcome, Rand and Stephanie, to PetAbility.
Welcome, Rand. Welcome, Stephanie.
Thank you so much. We're so happy to be here.
We are. This is wonderful. Thank you.
Can we just start by talking about what are some of the common signs that people can look for that indicate aggression?
Ooh, that indicate aggression. This is a great question. And you'll probably notice throughout this conversation that Stephanie and I will check in with each other on each of these. So Stephanie, please chime in. But I find myself often having a conversation with people about aggression being much broader than maybe what people initially envision. So there's an image I really like called the ladder of aggression. If you Google it, the same image pops up over and over. I'm actually not sure where it started, but it starts at sort of really low levels at the bottom, and then aggression such as biting and tearing, like intense bites, at the top of the ladder. But the rungs on the ladder get towards the bottom very, very basic. So things like mild stress signals, a dog yawning or turning away, licking its lips, whale eye. Some of these might be familiar to listeners as stress signals, as signs that a dog is a little bit uncomfortable. The reason I bring that up is that I find it really interesting that that is on the ladder of aggression, that we can think of that as like the lowest level of that ladder of aggression. And I sometimes just think about aggression as, I think of aggression as those behaviors that might contact escape for the dog. So behaviors the dog might engage in to get more distance from something scary. Stephanie, what would you add to that?
I take a very similar approach. And I think that the only thing I would add is that every dog's maybe constellation of behaviors we would label aggressive is going to be different. So the ladder of aggression is a great starting place, but it's important to note that each dog might have different early stress signals. So some dogs might yawn or lick their lips or turn away, where others might shake off their body or hold their body in a different position. And so we always have to look at the individual dog, but there are often, and we are usually looking for, what are the earliest signals of stress before something something that people might term aggression occurs, like a bite or a bite attempt, a lunge, a growl. There are usually more subtle indicators that happen earlier on, and that's what we're usually on the hunt to find.
I'm surprised that that's on the first rung of the ladder, but it does make sense, right? And I think that these dogs on that first rung, maybe they have an opportunity to sort of rehearse that behavior, right? Okay, this works. Maybe I'll do it again. And if it doesn't work, maybe I'll go to the next rung of the ladder. I'm thinking about, is the why important? Is the why the dog is behaving like this important? So if it's environmental or social or genetic, or possibly, I mean, maybe with the exclusion of pain, do we need to know the why to work with that dog or treat that dog?
I am happy to jump in on this if you don't mind, Ran.
Yes, please.
I would say absolutely. And this is perhaps something unique about our approach. We really don't do a kind of one size fits all. If your dog bites, you do this. If your dog, like, it doesn't matter why, this is what we do. That is really not the approach we take, because there is a substantial body of literature that suggests that when we match our treatment or our training program to the why, we are likely to be more effective, more efficient, and outcomes are going to be better. You know, as particularly when we're talking about pain and potential medical causes for these kinds of behaviors, if we aren't addressing those sorts of things, sort of the root cause of the aggression, we're not likely to be very successful. There's some kind of underlying medical cause or some particularly important environmental component, and we are leaving that out. There's no reason to believe that we're going to be able to fully address the behavioral concern.
And I think that we, as owners, might not even consider the pain is related to aggression. So sometimes, for instance, I had a dog many years ago who came in with a very large open wound on his elbow. And historically, this dog is very, very sweet and wonderful. But he came in already snapping, whale eye, ears down, giving all the signals, of course. And when that wound was healed, then he was back to his, happy, lovable, soliciting affection kind of guy, because that's who he was. But I think people should also think about things that maybe they don't put in the category of, like, this is going to cause a behavior problem, like dental pain, arthritic pain, pain from maybe cancer, pain from immune-mediated diseases. So I think we need to look out farther when we're talking about pain and pain-related or pain-related aggression.
Yeah, I think one thing that I hear a lot of people say when I suggest that pain might be an underlying cause is, oh, well, he doesn't cry, or he's not whining, or he doesn't yelp. Maybe we're talking about reluctance to go up and down the stairs, and I bring up pain, and they might say, oh, but he never whines or yelps or limps when he's going up and down the stairs. So I will often talk about, like, having a bad headache. Like, if I have a bad headache, there's sort of nowhere on my body that you will touch me that will make me have a more extreme pain reaction. Like, you can poke me in the knee, you can poke me in the shoulder. I'm not going to, like, shriek in pain, even if I'm in a lot of pain from this headache that I've had all day. That said, on a day that I don't have a headache, if my partner says, hey, can you wash the dishes tonight, I'll probably be like, yeah, no problem. And on a day where I have a horrible headache, if my partner's like, hey, can you wash the dishes? I might be more likely to be like, you always want me to wash the dishes. It has nothing to do with the dishes themselves, but this pain that, again, is not evoking yelping might be contributing to a more aggressive response to, like, normal or typical environmental stimuli.
Yeah, and I guess in my experience, I've had a lot of owners, I'll say, kind of be in denial that, they'll almost chastise their dog. They're like, oh, stop being such a butt. Come on. You always go outside at 8:00. Let's go. What's wrong? That kind of reaction, and not taking a step back and thinking, oh, yeah, we hiked for 2 hours yesterday. They're 10 years old. I'm sure they're sore.
Mm-hmm.
And kind of putting, I guess, a behavioral component solely as the attributing factor, but again, going back to the why. So thinking about what the why may be. And that's what I kind of want to turn people onto today, listening to this podcast.
And there's so many subtleties to animals and their response to pain. We really have to tune into those subtleties, facial expressions, body language, sleeping positions, eating styles, things like that. So there's so many other subtleties to watch out for if we are looking for pain in our pets.
One of the biggest signs that I've seen a number of papers that have shown evidence for this is sound sensitivity. So there's quite a bit of evidence that sound sensitivity is correlated with pain. So I recently met with someone who is expecting a baby, and their dog has a really hard time at night reacting to a lot of different sounds. And they're most concerned about that because the baby might cry in the night. They're already looking at, getting less sleep once the baby comes. And as we talked more, they also mentioned that she is slow to lie down. Like if they tell her to lie down, she's slow to lie down. If she sits down, she gets up right away. And again, I am a behavior consultant and dog trainer. I'm not a vet by any means. And so I'm not qualified to say, yes, there is pain. But all of this together said to me, you need to go check in with your vet and see if pain might be contributing to this, and if there's medical support that they can offer to see how that might impact behavior.
If we know there's pain, so that a client has worked with their veterinarian, or we're suspicious that might be relevant, we will often look at what are the behaviors that we're seeing that lead us to consider this, and is there some way for us to measure or keep track of them, particularly if we suspect that resolution of pain for the dog is either not going to be fully possible or is going to be a long road. Is there a way for us to take some data so we can see what sorts of things help? What things result in less pain, what things result in more pain responses. And again, this is our perception of pain, right? Because we can't ask the dog on a scale of 1 to 10, which one represents your pain, but we can look at what behaviors they're emitting that kind of lead us to think that they're in more or less pain, and start looking for some patterns so that we can promote as much comfort as possible and try to prevent or avoid situations that might lead to aggression as a result of pain.
Can you give some examples?
Yeah, absolutely. One client that I work with had a dog that had a pretty complex medical presentation, a number of different potential diagnoses, but they had a great veterinary team and were quite certain that this dog experienced a lot of pain. And so one of the things that we did was we looked at, unfortunately, this was also a dog that needed pretty regular handling and veterinary care, tried to figure out what sorts of activities are going to result in the least amount of pain for this dog and keep everybody safe. And so this was a guardian who was doing some muzzle training because the dog had to experience a lot of veterinary procedures. Wearing a basket muzzle could increase safety. This was also a dog who, because of the challenges that he had, they really wanted to wear a harness so that any kind of movement out in the world on a leash would distribute kind of the pressure of the leash, wouldn't be concentrated around his head and neck. This was a dog that did a lot of training, so we had a lot of very cute tricks. And so one of the things that we looked at was when we do each of these procedures, how many potential stress-related responses do we see? And that for this dog, that might be lip licking, kind of these little freezes. So he would suddenly stop movement. We might see some whale eye, you had mentioned before, where we can kind of see the whites of the eyes. So we looked at across these different activities of training that are meant to support his access to the care that he needs, which ones result in the most amount of those stress responses and potentially as a offshoot pain. That was one thing that we did because it helped us identify if he's having a good day, what might be some training options for him. If he's having a not so great day, what should we avoid, or what would we maybe skip today? But the other thing that we did for this dog and for other dogs is we created a rating scale for him. It was a 1 to 5. And a 1 was he's at his absolute worst. So he's really not moving. We're seeing many more stress responses, potentially some responses higher up on that aggression ladder as he's moving about his day. A 5 would be a fantastic day. He is having very few stress-related responses. He is participating in the activities that he usually does and seems to enjoy. And by doing a daily rating, that helped that guardian determine, one, are there any changes in our perception of this dog's pain? So does it seem like he's having increasing pain and we need to get back in touch with the veterinary team? Does it seem like he's having decreasing pain and things are going pretty well? But also on any given day, noting kind of our general perception of his pain, how can we make things easier for him? So perhaps we're not going to try to go out for a long walk, or we'll skip the training exercises that we know are maybe a little bit more stressful for him or uncomfortable for him. So that was perhaps one of the cases that I've worked on that was a more severe presentation of pain and where pain had been clearly identified. But this little bit of data wasn't too effortful to collect and really helped us tailor day-to-day interactions with the dog to try to promote as much comfort and as little aggression as possible.
Do you think that there might be specific breeds that are more prone to going to that top tier ladder rung, going right to aggression? And is this maybe even related to their pain sensitivity or their pain tolerance? So for instance, I think about dogs that come into the veterinary clinic, and there are some dogs that seem to be very dramatic and vocal. So are some of our northern breeds dogs, so some of our huskies, if you're trying to draw blood from them, then you may get, the howling or the barking or whatever. And I'm not sure that their pain tolerance is any more or any less than any other dog, like the labs or the goldens that come in and go, whatever you want to do is fine with me, right? I consent to everything. But I'm wondering if is there a breed disposition to going right to aggression?
There isn't. I haven't seen any evidence of that. I've seen a number of people asserting a number of different things about breed-specific behaviors, but I haven't read much compelling research that outlines like convincing breed-specific responses. I do think that there may be more individual history, and I think that can vary widely too. So I'm thinking about a dog that maybe has a history of things really going at their own pace or having options to opt out of procedures. Some dogs with that learning history might be really confident going in and doing something because they're going in with a lower stress level. Other dogs might go in and have things look different and panic much faster. So I'm not sure that there is a generalization to be safely made here. And I guess that goes back to how we approach all of this, which is really just looking at each individual dog.
Right. I don't think personally, without having any data, I don't think that I recognize that aggression does not seem to be a breed specific trait in any one breed. You have to look at the dog or each dog as an individual.
Right. And then we're also considering a learning history, something that I thought about when you mentioned like rehearsing some of those lower level behaviors is we sometimes see dogs who have been punished for growling, or, they've growled and someone has yelled at them, or they've growled and they've been reprimanded in some other way, or they've growled and been put in a crate as a response, or something like that, so that over time the growling decreases, but we're not actually seeing the dog change how they're interacting with the environment. They've just learned not to engage in this one specific response. And so then we don't necessarily know if they're not growling when they're that level of uncomfortable. And that's where we might see a dog that appears to bite out of nowhere. The dog was just laying and relaxing, and then out of nowhere it bit. So I generally, when I talk to people who have a growling dog, I want to celebrate that. I don't love that the dog feels however the dog feels that is making them growl, but I do love if they're feeling that way, that they're telling us about it. And we want to keep them telling us about it, because then we can do what we can to make the environment better and safer for whoever is involved. And in some situations, that might be like visitors come to the house and the dog growls at visitors. Okay, let's see about putting the dog somewhere where the dog feels safer, maybe like in a room with a good bone. If we're in a veterinary setting where whatever the procedure is really has to happen for whatever reason, and it's not an option to not do whatever it is we're doing, that growl can tell us that maybe we want to make sure that there are safety measures in place, like muzzling or sedatives or something else to make sure both that the dog and the staff are as safe as possible. So I really hope that people take away that while feeling the need to growl is obviously not a good thing, the growl itself is something that we definitely want to keep.
It's communication.
Exactly.
And I worry about that because I worry that those dogs that either growl or maybe even act out aggressively because they have pain then might become labeled. And then that becomes a whole situation for those dogs. They're become labeled as aggressive at the vet or at the groomer, or God forbid, they're surrendered to the shelter. And now that they have a history of what people might see as aggressive behavior because they were growling or because they have pain and they were acting out. So I worry about those. I worry about the thought about growling in general.
Yeah,
Absolutely. One thing that I would add, I always love listening to Rand talk because it's said everything so beautifully. We might see a dog who growls and it feels very sudden because of a punishment history, or maybe they engage in a more severe behavior because they've been punished for growling. Sometimes it's just a matter of we haven't identified earlier symptoms or behaviors associated with stress. And so the dog was perhaps engaging in behaviors that indicated discomfort that were missed. And so we saw that escalation potentially as a result. And in addition to kind of really looking at the individual dog and celebrating that growling, I would say that if we can become even better observers of our dogs and the more nuanced behaviors that they engage in when they're stressed or uncomfortable, that can go such a long way towards giving us more options of ways to respond and help support them.
that makes me think of one of my favorite clients who I worked with a while ago. Was wonderful golden doodle with a bite history. He was about a year old, I think, and he would roll over. His family shared with me that he would roll over on his back for a belly rub. And then when they went in and rubbed his belly, he would start growling at them. And so they felt very, very confused about, like, he's asking us to pet him and then we're petting him and he's growling at us. And this is really scary. And I imagine how unsettling that would be to get that invitation and then to get that response. And they sent me some videos of what it looks like when he rolls over to request the belly rub. And I think something a lot of people don't know is that sometimes rolling over and showing the belly can actually be a sign, sort of a request for space signal. So a don't come near me, sort of an appeasement. I'm not a threat. Here's my belly. Just leave me alone. No big deal. And so in this case, this dog was seeing his people approaching him, rolling over to say, don't come over here. Just leave me alone. And then they were interpreting that as please touch me right up on my belly. And so no wonder he started to growl. And so once we identified that that was going on, they were able to just stop interacting with him when he showed his belly. And we saw an enormous decrease in the growling behavior.
I can attest to that personally. My Cavalier Baxter, from some interaction with somebody else that helped train him, I guess, raise him for a short time. His communication was punished out of him, and then he stopped growling and would just snap. So kind of going back to what you were saying earlier, without the warning. Now, fast forward 7 years, I've appreciated the growling, tried to reinforce the growling. He does it far less. And I very much know that he wants space at that point. So it's, again, mixed signals, Rand, because he likes to be really, really close, but on his own terms. So you give 4 inches of space between the couch and your body, and he will snuggle in there and jam himself as tight as can be and feel safe and loves it. If I were to pick him up and put him in that space, or push him, to kind of situate him, he would. So I'm like, fine, do it on your own. And I've really seen a change for the better because we're understanding each other and what he's trying to tell me. Do you work with veterinarians and recommend certain pharmacological agents to help with things? I mean, we're talking about pain and, potentially leading to aggression. I also don't want to dismiss like medical components, because I think that many times a medical condition is painful right? Concurrently, urinary tract infections, kidney issues. You know, Kathy and I are very much enveloped in the whole musculoskeletal system, but there are so many organ dysfunctions that cause referred pain and things like that. So do you work with vets? Do you reach out to them and discuss the potentials of you using some of these drugs?
Sort of. So I typically try to support clients in having those conversations. It used to be that I would say, ask your vet. And then I'd say, how did the vet appointment go? And they'd say, well, they asked me why I think the dog's in pain. And I was like, well, my trainer told me. And the vet was like, well, are they yelping? And I was like, no. And then the appointment was over. And so I felt like people didn't have enough information, and, you know, it can be stressful going to the vet. And a lot of the people that we're seeing have dogs that are having a really hard time already. So also going to the vet with a dog who is already stressed or uncomfortable is really hard. So we started writing letters to the vet, really outlining what we're seeing and why we're referring them. So, you know, I've been working with these people for this long in this context, and then here are the list of reasons that I'm suggesting they reach out to you. I'm always really mindful of what is within my scope of competence and what is not. So the more dogs I work with and the more folks I talk to and continuing education I take, the more I feel confident about what I know about pain. But I also know that I am not the person to say, here's the med you should try, or here's what it isn't, or even like, this is pain. It might not be pain, or maybe it is, you know, a ongoing nausea. Or I had a dog that I knew that this dog had a skin condition as a puppy, but I didn't know enough about it to know that that could have lasting effect into adulthood. And when those folks saw a veterinary behaviorist, she identified that the discomfort from that condition he'd had as a puppy could be contributing to some discomfort he was experiencing as an adult. So I try to really lay out what I'm seeing and why I'm recommending that they consult with their vet. And then, of course, say I'm available to the vet as needed. And I feel like people have been really relieved to have that, and that it has been helpful. Most of the people that I have given a letter to have come back with a medical plan for their dog.
I think there are some very obvious signs for clients that their pet might be in pain. So obviously an injury, osteoarthritis, post-op surgery, things like that. But we also have to consider some of these subtleties like mouth pain, infections, UTIs, gastrointestinal issues, pancreatitis, very, very painful disease, and inflammatory diseases such as, you know, autoimmune or these immune-mediated diseases can cause pain. So I like that you're interacting with their veterinarian and helping them sort of pinpoint where this patient might be having some discomfort where we might not see an obvious sign of pain.
Yeah, and I think that when you mentioned osteoarthritis, I think that can be an obvious one for people who know that that's something that their dog has. But also when they live with their dog every day, it can be harder to notice what some of those subtle signals are. And if it's not a sort of normal presentation, I'll just throw myself under the bus here and say, when my dog was 1.5 years, she was just always having trouble settling. Like she would just sort of walk around the house. She's not a very high energy dog, so she wasn't bouncing off the wall. She was just like, I want to go out in the yard. I want to come in. I want to get on the couch. I want to get off the couch, just sort of going. And one of my friends, Dr. Stephanie Keasey-Phelan, said to me, I think she might be in pain. And I was like, I don't know. You know, she's 1.5 years old. And she said, okay. And then a month or two later, she was like, you know, maybe she's in pain. And I sort of brushed her off, and she was very patient with me. She eventually sent me a webinar that talked about different signs of pain in dogs and some really subtle things like trouble settling, like ear carriage, that an asymmetrical ear carriage that's not just like one ear flops up and one ear flops down, but actually holding their ears asymmetrically can be a sign of pain. A low carriage of the head, like holding the head lower than the spine, can be a sign. And I was watching this webinar and just going like, check, pulling up pictures of my dog, you know, lying and relaxing in the yard and noticing that her ears were asymmetrical in all of these pictures. And I ended up seeking a ton of veterinary support and learning that my 1.5-year-old had hip dysplasia and arthritis. And something interesting about this too, that I've learned in my own journey with her, is every vet I've talked to has said, we might see a dog who has really severe arthritis and shows minimal signs of pain. And then we can have a dog like my dog who has actually pretty mild arthritis for a dog her age, who is really impacted by it. If she's in pain, I see a pretty noticeable, for me, difference in her behavior. So it can be really subtle. And I think that that's also something that we can bring in, just another set of eyes that isn't living with the dog day in and day out, because it's so easy to miss the subtle things that have sort of crept in. I'll also say, once we got Beacon on a good pain regimen, she was able to relax. I thought I was just stuck in, like, how do people teach their puppies to relax? I thought I was a dog trainer. What is wrong with me? And it turns out she was in pain. And once she had pain meds on board, she could get up and go for a walk and have a great time. And then she could also come home and settle and sleep well. And that was life-changing for my entire family.
So, Ran and Stephanie, what are some of the potential long-term consequences of untreated pain-related aggression in dogs, both for the dog and their human caregivers?
Oh, I think there are so many, and so many different possibilities based on kind of what that looks like for the individual dog and their family. I think the first thing is that there's some medical problem, and so that could potentially be getting worse and becoming more severe for the dog. I think that anybody who has lived with or interacted with a dog who engages in aggression can attest to how stressful it is and how impactful it is for everybody's quality of life. The people in the home, the dog, anybody the dog is interacting with or coming into contact with. So it's just a huge challenge to live with a dog that is engaging in aggression quite often. It may also lead to trying a lot of behavioral treatments or making some of the assumptions we talked about earlier, that, the dog is just being stubborn or, upset about something that doesn't make sense or that we can't pinpoint. And so that might lead to all manner of different types of attempts to change the dog's behavior. I think it can't be overstated how detrimental the outcomes likely would be if that pain didn't go addressed or if it went uncovered. Even when I'm thinking about this, I'm thinking about dogs that are engaging in aggression in the forms of lunging, growling, biting, and those sorts of things. But if you even just think about, and maybe Ran, you might want to speak to this, what it was like, living with Beacon with pain that was unidentified. Beacon wasn't, to my knowledge, trying to bite you or growling at you or any of your family members, but I perceived that may have taken a great toll. I wonder if you have any thoughts on that.
I think I mostly just remember the starkness of when she was feeling better and having her relax. In the evening, after you have your whole long day and we've done the training and the walking and the feeding and we've had our dinner together and we all just want to sit down and relax. And the dog is like, I'm going to go in, I'm going to go out. She used to go upstairs and flip the toilet lid up so it would slam, I think because it got our attention we'd be like, okay, we're just going to sit on the couch. And if we just don't pay attention to how much she's moving around, then at some point she'll settle because she'll know that our attention is unavailable. So then she learned how to flip the toilet lid. And this wasn't a crisis or a high level, big stress all the time, but it was this constant low level stress that also, if anyone's heard me talk about my dogs, they know that I am a dog person and my wife loves me very much. And so she also loves the dogs that we share our lives with. But that was really stressful in our home. She didn't sign up for a dog like this. On the other hand, and she would say this, she signed up to fully support any animal that is in our home. But it was really hard. And as Stephanie said, we weren't seeing any aggression. I wasn't seeing any aggression at all. But it would also be understandable, if she felt that bad, if we did see aggression. And my wife does sometimes ask just, what would we do if Beacon bit us out of nowhere? Like, what if that happened someday? And this is coming for her, I think, just from a curious place. But when I try to answer that question, I keep coming back to, she's never going to bite out of nowhere. If she were ever to bite, there's something underlying that. And maybe at first we wouldn't know what that is. And that would feel really scary to have or a snap and have no idea why that happened. But there's always a reason. We just need to find out what that underlying reason is. And that can also help us better understand how to prevent it from happening in the future.
I guess that's the point of this whole podcast, is that pain can very well be one of those reasons, whether it's due to some injury, neuromuscular issue or medical condition. And, when you were talking, Stephanie, when I was thinking of long-term consequences, I was kind of going down the path of my aunt was just visiting, and she has chronic back pain, and she was exhausted. Chronic pain is exhausting because everything you do takes so much energy, and it weighs on you mentally and emotionally. And, so sometimes if people can put themselves in situations that they've experienced in their dog shoes, if your dog has back pain, again, they can't talk to us. It may not be obvious, like the headache symptom that Ram was describing earlier, but it's there. And so just knowing that it's very fatiguing. And I also think that if it leads to a change of behavior, such as aggression, that can be very isolating for the dog, because many times, they then are not invited to participate in things, whether it's leaving the home or they're put in a room, where they feel safe and the company is safe, when you're having people over, those kinds of things. So it leads to changes in routine and so forth, and ultimately could be less enriching and more isolating.
It does break down the human-animal bond to have that chronic, unrelenting, untreated pain. And you're right, dogs might isolate themselves. They might isolate themselves from their owners. They might isolate themselves from other animals in the house. And it can be I think it could be a very helpless feeling for those animals.
For the people too, I think. I talked to a lot of people who, they used to have dinner parties, but now their dog won't allow such things in whatever iteration that is. So, or maybe they used to go out a lot, but now their dog can't be home alone. And so I think that these same challenges can also be barriers for people to have their needs met as well, which, as you mentioned, can have an impact on that relationship as well.
And that's what I really love about the Dog Behavior Institute, because you make it very clear that you support not only the pet, the dog, but also their people. And I think that's really cool.
Not every dog is experiencing pain, but it's such an important thing to rule out, particularly if the behavioral change you're seeing, whether that includes aggression or not, feels sudden or feels hard to explain. When you're noticing a dog that you have lived with for a little while start to engage in different patterns of behavior, whether that's moving around their environment differently, avoiding or seeking out certain spaces, or you're starting to see these kinds of aggressive responses, it's so important that we ask the question, could pain be relevant? Could there be an underlying medical condition? Because we really aren't, there are certainly behavioral things that we can do to help support a dog in pain, but they are not going to necessarily address the root cause. And so to that end, I would say that referring back to a veterinarian and collaborating with veterinary teams is such a critical part of this process. And that I guess I would say that being a good observer of your dog's nuanced and subtle body language is a skill that can really help you identify changes that might need attention. And so learning about dog body language would be one of the number one things I would suggest that people do.
Two resources that I really like, and one of these is fully self-promotion, include Doggy Language by Lily Chin. She also just came out with a kitty language book this year. So it's a little sort of cartoon book, and it looks super simple, but it is just packed full of information. I cannot say enough good things about doggy language. And then the other resource is on our website, right at the top of the page, there's a little bar that says like, learn more about dog language or something like that. And if you click through that, you can put in your email and get sent a video that we put together with a little more information about dog body language. So it's about 15 minutes long, and it's just a recording of a presentation that we do covering sort of high level basics. But I say high level, but it's also information that a lot of people don't have. So going into a little bit more detail than people might be familiar with around changes that we might see in the face, in the head, in the body position, and tail.
So we'll put those in the show notes as well. I think sometimes we think our German Shepherds and our Rottweilers and our pit bull breeds and our labs have like a super pain tolerance and don't feel things. I mean, I think there are people that are really naive out there and oh, that doesn't hurt them. And, I just, that makes me cringe because we all have the same nervous system. Dogs are very similar to us. And, their exposure in the environment may change the way they deal with pain. You think about, what a football player endures, on the human side. And then, what a working dog may have to endure on a farm or something like that. It's a more physical job and environment and so forth. We've even learned that fish feel pain, crabs feel pain. So I think any creature has that ability. And that's something, even 30 years ago, we were questioning if dogs felt pain at all. That's a relatively new phenomenon. And speaking of that, I also learned that if a dog is born with a painful condition due to something congenital or experiences pain very early in life due to trauma or medical condition, that they are more sensitized to pain as they mature. So that is one thing that I think if you have a puppy or had a puppy that's now a dog, that you need to be aware of. And then the other thing on the opposite end of the aging spectrum is, how many people we all heard that say, oh, my dog's old. He's really crotchety now. He's turned into an old grump. Just because they're old doesn't mean they should be crotchety or grumpy. So again, why did their personality change? Is it because they're riddled with arthritis? Is it because they have, GI distress? Is it because I could go on and on?
Dental disease is one of the top things in my mind for senior dogs that have pain. A dental pain in dogs is something that is often overlooked, but mouth pain, if you've ever had mouth pain or a toothache, it's on the top tier for pain level. So it's something to really think about for pain-related conditions.
And one more example is I've had many of my clients report to me that their dog's behavior has changed post-injury or surgery. And one dog is our friend Libby, Kathy, that we use as our demo dog. So a lovely golden retriever. And, you can do anything to Libby, and she does not exhibit any signs of pain, but she has had 2 torn cruciates relatively close together and had surgery for both, TPLO surgery, and I rehab both. And she is as strong as an ox. She has full range of motion. And again, no signs of pain. But what's interesting is that her owner has reported that now she is very dog reactive. She used to play with dogs and things, and now it's an issue. And that is what the owner attributes to, the fact that she was injured and had surgery, to that change in behavior. So is there something underlying? I don't know. It doesn't seem to be pain related, but, we're talking about, sudden changes. Stephanie had mentioned that. And, in your case, Ran with Beacon, I think, that was more of an insidious onset, gradual. So it was easier to kind of, is it or isn't it?
Right. Well, and that's interesting too. I think this probably overlaps a little bit with what we talked about in the punishment episode, because I imagine that a dog who is uncomfortable like experiencing pain, and they're going out in the world. And I'm not saying this was Libby's experience, but they're going out in the world on their walks while they're painful. And then they see another dog and they tense up a little bit. Like, do I know that dog? Maybe they tense up in excitement. I want to run over and see that dog, but they're recovering from surgery. So they tense up, and then that causes some pain. And so then they are making that association that that dog is going to cause me some pain. And that, and there's not really a way to guarantee that that is what has happened, but I think it's a compelling story to consider that a dog who has experienced pain and then been exposed to some stimuli while experiencing that pain might respond differently to that stimuli or to those stimuli later than they did before the surgery or the injury. I did the Family Pause Parent Education Program this last year, and one of the things that they talked about in the course is that a lot of dogs that have been trained on electric collars have seen those little flags that they use to put up the barriers, and so they associate those flags with the electric shock. And then maybe many years later, we see a kid in the house with one of those little like pushy stroller things that, you know, a toddling child might use that has a little flag on it. And suddenly we have a dog who's snapping at a kid. Now that dog is not actually reacting to the kid. That dog is reacting to the flag and the history that came with the flag. But the person who runs Family Pause, Jen Shryock, said that this is something that she has seen a number of times. And so I know we're not talking about punishment here, but it does make me think about, like, what are the things that the dog is noticing and making associations with when they're experiencing pain? And how might that come up later at times that we might miss that connection?
One thing that I wanted to just mention is I think that our shelters and rescues have done a really good job with education on their websites in terms of trying to keep pets in their home. If people are considering, you know, giving up their pets for adoption because of a certain behavior, and recommending that people explore medical issues and pain and things like that before. So exhausting all those possibilities, because maybe they don't need to be, you know, surrendered if that medical condition is addressed.
Just keep in mind that proper pain management can include a lot of things. So it maybe includes medication, maybe it includes physical rehabilitation or surgical intervention or supplements for addressing the root cause of pain. So there's no shame in seeking out good pain management for your pet.
And the Medcovet Luma is always a good drug-free option to manage inflammation.
I love that Medcovet Luma, Chris. It just has so many applications to our clients who have any type of inflammation or pain or chronic condition.
Do you have any last thoughts that you want to leave our audience with?
Yes. And this goes back to something I said earlier, I think, but I just want to encourage people to also be gentle with themselves. I think that it can be emotionally really hard to learn that behavior challenges have been associated with pain. You know, finding out that our dog was doing this thing that we were like, this is annoying, or why are you always doing this? Or just, even if you didn't say those things out loud, it can be really frustrating to live with challenging behavior. And I think that then finding out that it stemmed from pain can make guardians, because all guardians love their dogs and we're invested in our dogs, feel bad about not considering that sooner. And so I just want to make sure there's space to say, like, we're all always doing the best we can with what we have. And when we have more information, we do better. But to not give themselves too hard of a time for overlooking signs, because we can only do what we can do when we can do it.
As we're wrapping up, can you let people know where they can find you?
Yes, we are at thedogbehaviorinstitute.com. And then we're also on Instagram and Facebook. The handle on Instagram is at the Dog Behavior Institute. And those are the primary ways to reach us. We do have courses for people, as well as our classes and programming for dogs as well. And that is all on our website, as well as in our newsletter, which you can sign up for on our website.
Fantastic. Thank you, Rand. Thank you, Stephanie.
Yes, thank you very much, Rand, and thank you, Stephanie.
We'll talk to you soon. Bye.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at PetAbility Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you and tune in next time.